Okay, last time we had a small discussion about mycoplasma as far as I can remember. Okay, let me try and do this. Okay, yeah, now it should work. So pretty much with our conversation regarding mycoplasma, we have finished talking about it should pop up there, I hope, in a second. We have finished discussing the pathogenic gram-positive microbes. And the last thing to mention is not so pathogenic gram-positive microbes. I am talking about these three guys: bifidobacteria, lactobacilli, and leuconostoc. These are what can be found, especially, well, two of them, bifidobacteria and lactobacilli, are the ones that can be commonly found in probiotics. Okay, they can be found in probiotic pills, or sometimes, well, not sometimes, practically every time, you can find them in various fermented foods. Okay, bifidobacterium can be found in foods like yogurt, mostly yogurt. Lactobacilli is pretty common in virtually every food that involves acidic fermentation, starting from sauerkraut to yogurt to cheese to kefir, beer, cider, everything. As I mentioned yesterday, we had a little conversation about probiotics. The actual mechanism, how they work and whether they work at all, it's still a little controversial. And the main consideration point for probiotics, think about this. We have trillions of microbial cells in the gut that are constantly competing with each other. You would look at the number of bacterial cells that manufacturers claim to be in yogurts. It's usually about 10 in the power of 6 per gram or per mil. Okay, you eat a cup. 10 in the power of 8. It's still hundredths of a percent compared to the total population of a gut. So you're eating a minute fraction of the stuff that's already there. To expect them to immediately start to grow, to get into the logarithmic phase and just smash all the bad stuff is, I would say, not realistic. Studies, though, various studies of a smaller scale, they show that they indeed help, with different diseases. Common cold, that's for Bifidobacterium longum. Ulcerative colitis, which is usually autoimmune condition associated. It's all in the realm of inflammatory bowel disease. Lactobacilli help with conditions associated with IBD, Crohn's, necrotizing enterocolitis, all that stuff. That all comes in under the same sauce. Let's put it this way. Now, they all parts of the normal human microbiome. Bifidobacterium is intestinal, mostly, less vaginal. Lactobacilli is the most common genus in the vaginal microbiome. Okay. Again, with probiotics, the problem is that people are often non-compliant. You cannot establish all the interactions that are in the gut. And studies show that probiotics do relieve symptoms of enterocolitis. Now, with all dietary studies, I saw somewhere recently an amazing study. Oh, yes, just an example of treat the dietary studies carefully. Study shows, it was in Time magazine, study showed that people who consume 2 or more servings of French fries a week have higher chances to acquire diabetes. Sounds reasonable. No, seriously. Now, you have to think about studies like that. If you eat healthy, you don't just go and buy 2 servings of French fries per week. Usually people who buy 2 servings of French fries per week just generally do not eat healthy on any other given day. Does that make sense? It kind of tells more about the general dietary habits. So people with these type of dietary habits are more likely to have diabetes. It's kind of obvious. Okay, so you really have to be careful about studies like that. And in addition, the N number always has to be considered. So if you would talk to, I don't know, 10 different microbiologists about probiotics, you will have 10 different opinions. I have none, seriously, because I just like yogurt and like kefir, so fine with me. Whether they do me good or bad, I don't know. There was a famous Russian immunologist, Ilya Mechnikov, who was the proponent of drinking different types of probiotics, and he thought it's going to cure everything. Apparently it didn't. He died at the age of 80. There was an interesting example of probiotics. It was N of 1. It's half of it is urban legend, half of it is not. It was actually a case, but the N is 1. The woman who had tuberculosis, she was advised to go to some part of Russia, Caucasus Mountains, and somebody told her that, folks there can treat it. So she drank the local type of that milk product, fermented milk product, something like kefir yogurt. And in a year, she recovered. It was beginning of 20th century, so no specific antibiotics, no vaccine, nothing like that. Maybe these guys have certain immunomodulatory properties. Probably do have. So just let's watch out for more studies. Leukonostoc is the environmental bacteria that can be used and sometimes is a component of starter for things like sauerkraut. Surprisingly, this apparently benign bacteria in immunocompromised patients can cause nosocomial infections, for instance, wound infections. Okay, and it adds to that set of examples, set of examples that we established. Microbe that otherwise can be absolutely benign, if it gets not only in the sterile site, if there is not enough, if immune system is weak to suppress it, then it can cause disease. And it's going to cause disease not because it's malevolent or something. It's just going to replicate in your tissues because it's perfect, environment, nutrient, no competition. Great. Does that make sense? I'm going to stress this idea of, wrong place, that a lot of bacteria can be considered opportunistic, like Leukonostoc. Now we're moving to gram-negatives. All the rest of microbes are going to be gram-negatives. And, by the way, you will have to know whether the microbe that we mentioned is gram-positive or gram-negative. I will ask you that in one or another form on the exam. Did I make myself clear? So it's not going to be just which of the following microbes is gram-positive. It's going to be more complex, so this gram-positive microbe causes blah, 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 blah. And you have a couple of options, and you have to figure out which one of them is gram-positive. Okay? As I mentioned, if you go on the website cram.com and type in my first and last name, there will be a user with my first and last name, that's me. And there are flashcards, and one set of flashcards is pretty much about gram-positive, gram-negative. Okay? You can make them yourself, it's not a problem, but just if you want to, you can use those. So, gram-negative bacteria can be divided in multiple groups and different classes. And I just show you the classes here: alpha proteobacteria, beta, gamma, delta, epsilon. There are many of them. You don't have to know these groups. Don't worry about that. Just gram-negative. And we're going to start with two. Ehrlichia is not going to be here. I accidentally put it in the title. We're going to start with two genera. The genus Bartonella and genus Brucella, and with just few representatives of those genera. So those are typical gram-negative microbes: Bartonella henselae, Bartonella quintana, and Brucella bordis, that cause what is called non-hemorrhagic fever, which means that typical infection with this microbial species manifests itself as fever, malaise, sometimes bone aches, muscle aches, headaches. There is not a lot of specific symptoms. Some of them have specific symptoms, and we're going to discuss them. First of all, I want to mention all gram-negatives. For all gram-negatives, you can consider lipopolysaccharide as the virulence factor, right? Because all of them have lipopolysaccharide, and LPS causes those non-specific symptoms, right? So Bartonella henselae, you can see that flagellated microbe on the picture in the left bottom corner of the slide, is a causative agent of cat scratch fever. So it's not only the song by, crap, I forgot his name. You know who I'm talking about. It's not Todd Rundgren, but it will pop up. Obviously, it is zoonotic disease that can be acquired from cats, but not only cats, dogs, sometimes even domestic animals. It can be transmitted not only by a scratch, but also by a bite of a tick or a flea. But in this case, both ticks and fleas serve as the mechanical rather than biological vector. Bacteria does not replicate in them. Usually, that's the illustration of cat scratch fever in the bottom. It's number 3, okay? And number 2 is the human louse, which will be relevant to the next one. So number 3 is the picture number 3 is the cat scratch fever. You can see the little pustule on the hand, and usually the infection itself is limited to the pustule on the skin and general fever, and patient either recovers, if immunocompetent patient will either recover by him or herself, or after the treatment with antibiotics will get absolutely healthy. However, in immunocompromised patients, Bartonella henselae can cause hepatitis. And you can imagine that, untreated hepatitis may lead to the liver failure and eventually death. It's not frequent, don't get me wrong, but it can happen. Bartonella quintana was identified as the causative agent of the disease during and shortly after the World War I, hence the name trench fever. This bacteria is transmitted by human lice and manifests the fever One of the interesting features of Bartonella quintana is the pain in the tibial region of the legs. Just feature. So obviously, the reason why it became so prevalent in World War I was the hygienic conditions in the trenches. People were crowded. They didn't have a chance to take a bath or a shower or something like that in, I believe, weeks or months. Lice were more than normal, and they were just moving from one soldier to another, biting them and, transmitting the disease. That makes sense? Brucella abortus is the causative agent of brucellosis, which has several other names. Bangs fever, after the guy who first described the disease, and also undulant fever, because it undulates. You can see on the graph number 4 on the bottom right corner in the slide that the fever, the temperature, body temperature of the patient goes up and down. It's called undulates. In humans, in otherwise healthy humans, it causes just undulant fever. Sometimes it can be self-limiting. In most cases, it requires the antibiotic treatment. Without treatment, it can become chronic, and it's much harder to treat. It can become systemic if patient is untreated and immunocompromised. This, as well as Bartonella, Brucella abortus is the zoonotic disease that is transmitted from cattle. And while in humans it causes the fever, in cattle, as you can guess from the name, it causes spontaneous abortions. The photographs of the result of infection are very graphic, so I do not include it here. It doesn't only cause spontaneous abortion, it causes the abnormal fetal development. It's a big problem in the agriculture, especially in the developing countries. In South America, it's pretty much exotic in cattle. Now, these 3 microbes, Rickettsia, Coxiella, and Ehrlichia, are obligate intracellular parasites. And I want to stress it out. They all are obligate intracellular parasites. I highlighted here in the virulence factor, so please know that those are virulence factors for these 3. Now, Rickettsia, the genus Rickettsia, is comprised of probably 24 of species that can cause human disease. Perhaps the most famous human rickettsial disease is Rocky Mountain spotted fever. Picture number 1 in the left bottom corner of the slide. That is called by the species Rickettsia rickettsii. This microbe, Rickettsia, the genus Rickettsia, and the species Rickettsia rickettsii are named after the biologist, physician Ricketts, also discovered and described the calcium deficiency in children. It's all the same guy. Other diseases associated with Rickettsia is typhus, Rickettsia prowazekii, Rickettsia cari, rickettsial pox. It has nothing to do with the smallpox, but symptoms are similar. All these diseases, for all of them, one of the characteristic signs is the rash. In Rocky Mountain spotted fever, rash can, if untreated, rash can become necrotic. Those pustules can become necrotic. And if Rocky Mountain spotted fever is left untreated, mortality is pretty high, about 20%, which is really high for a disease. Now, this disease, Rocky Mountain spotted fever, as any other rickettsial disease, is transmitted by arthropods. RMSF is transmitted, Rocky Mountain Spotted Fever, transmitted by ticks. The Lone Star tick, number 4, okay, or Exodus ticks, or Dermacentor ticks. Some other rickettsia, Rickettsia prowazekii, transmitted by lice. Rickettsial pox is transmitted by mites. I had a question for you. I totally bumped it. Oh, Rocky Mountain Spotted Fever. In which region of the United States can you find it? Nope. That's the trickiest part. Well, it's kind of a deceiving name. Rocky Mountain Spotted Fever actually is found in Tennessee, Kentucky, Missouri, and Arkansas. Ticks are pretty common in dense forestation areas, and those states have pretty dense forestation areas. Why it is named Rocky Mountain Spotted Fever? It was isolated and completely described, scientifically described, at the Rocky Mountain Labs in Hamilton, Montana. And they named it not for the name of, for the place of discovery, but for the place of description. Okay, it is endemic in those areas, so beware. Speaking of ticks, by the way, what are you supposed to do if you get bitten by a tick? Well, except for panic, like screaming, "Oh, gonna die." You should remove the tick. How do you remove the tick? Huh? That works the best. We tried oil. Good luck with that. Spend like 40 minutes waiting for the little guy to come out, because the idea is that you put the oil, like canola oil or some other kind of oil, on the tick, and it stops the oxygen from getting to the tick. No way, it doesn't. The little fella was sitting in the skin, and we had to finally take the tweezers and pull the tick out. Be careful not to rip the head apart. Okay, what you're supposed to do with the tick next? Freeze it. Yeah, ideally freeze it and bring it to the physician. To a physician, be insistent and tell them, you know, we got a tick bite. I'm concerned. Can we send it? CDC. Well, your physician should know. It's either Department of Health and Human Services, the local agency, or maybe CDC, because CDC has to monitor all those diseases, zoonotic diseases in the US. And honestly, sequencing or determining what's in the tick, it's not such a big deal. Seriously. So it's a good idea to save the tick. And where do they live, by the way, ticks? I mean, you go in the forest. Where do they live in the forest? And, well, you have low chances to get it directly from the animals. Where do they live when they're not on animals? Grass. Grass. The belief that ticks fall from the trees is not true. They always in the grass. How they end up, like, on your head, or in your armpits, or behind your ears, or on your eyelid. I saw that. They crawl there. So if you go in the place which is tick reach, pants in the socks and spray with DEET. It's most important to protect you from here. So, you know, if they not on your legs, nothing's going to be up here. Okay? And they want like really thin skin, so it's going to be behind the ears, it's going to be head, it's going to be eyelids. They really like groin and armpits because it's dark and wet, and they love it, and warm. So those between your fingers, that's what they like. Now, Coxiella burnetii is a fairly rare disease. Okay, the most common route of transmission is zoonotic from domestic animals. It's endospore actually forming gram-negative microbe, which it isn't only capable of intracellular infection. It gets endocytosed in the cell, and remember, endosome is acidic. Okay, Coxiella burnetii can replicate in that acid. It successfully reproduces in the environment that should destroy it. Okay, causes the disease known as Q fever. Q fever is rather non-specific. Okay, just the name for it. Sometimes if the infection becomes systemic, it can manifest as pneumonia and endocarditis. And the third microbe that I wanted to talk is Ehrlichia. There are many species. Two of them are of clinical importance: Ehrlichia schiffiensis and Ehrlichia phagocytophila. Ehrlichia schiffiensis infects monocytes, and this is an example of Ehrlichia schiffiensis. You can see little intracellular microbes in the monocyte. Ehrlichia phagocytophila infects neutrophils, hence the names. Ehrlichia schiffiensis causes monocytic ehrlichiosis. Ehrlichia phagocytophila causes granulocytic ehrlichiosis. Again, very non-specific disease. For healthy humans, it doesn't pose serious risk. However, animals, domestic animals that are at high risk for ehrlichiosis are dogs, because they collect ticks like crazy. Okay, so prevent them from doing that. Chlamydia. Again, the risk, should I say risk factor for that, for chlamydia is intracellular growth. Chlamydia is another example of obligate intracellular parasite. Although it's not a virus, but it's still obligate intracellular parasite. Chlamydial cells, known as elementary bodies, are released from infected cell. Enter the epithelial cell, where they develop into the reticulate bodies. Then reticulate bodies in this inclusion vacuole, we can say, differentiate into the elementary bodies, and elementary bodies are released and infect another epithelial cell. So you can notice that actual reproduction happens inside of the cell. But of course, bacteria leave the cell to infect others. You can see the chlamydial cells on the surface of ciliated epithelium in the picture number 1. Okay. Now, what does it cause? It's a most common sexually transmitted disease in the United States. In females and in males, it causes infection of urinary and reproductive tract. Often goes asymptomatic or manifests with the minimal signs and symptoms. In both males and females, it can be discharge, unusual discharge, penile discharge, vaginal discharge. In females, asymptomatic infection often means that symptoms go unnoticed. And chlamydial infection, if it is undiagnosed and untreated, especially in females, can infect epithelium, go from vagina to the uterus to the fallopian tubes, and eventually lead to pelvic inflammatory disease, which is you can imagine, is a huge problem. In both males and females, if bacteria migrates into the lymphatic tissues in the inguinal lymph nodes, causes characteristic symptoms known as lymphogranuloma venereum that helps to recognize and to diagnose the progressed chlamydiasis. Now, another problem with chlamydia trachomatis is that it can be transmitted during the birth. If it's asymptomatic and undiagnosed, chlamydia trachomatis can be transmitted to a newborn and cause the condition known as trachoma, which is chlamydial infection of the eye, of the conjunctiva of the eye, conjunctivitis. You can see the characteristic cobblestone appearance of the conjunctiva when eye of a child infected with chlamydia trachomatis. Trachoma is the considerable cause of blindness and kinds of visual impairments in developing countries because often the access to antibiotics is limited. Okay, it's extremely infectious. It can be fairly easily treated with tetracycline, doxycycline. That's a primary treatment. Now, what I wanted to say. Oh, when I worked at one institution, my colleague, she worked before that, like 25 years before that. The lab worked on the vaccine against trachoma, and she described how infectious the bacteria was. There was a treatment, of course, but no vaccine. So they worked on trachoma. Every person, literally every person who worked with bacteria got infected. And believe me, they weren't reckless. So they worked in the biosafety hoods, they wore gloves, but it's so infectious, every person got trachomal chlamydial conjunctivitis. They were treated with antibiotics, so it's fine, but nevertheless, it's extremely infectious microbe. Okay. Bordetella and Neisseria. Now, I grouped these microbes not so much based on the symptoms or something else, but it was more about saving space. So this is beta proteobacteria, and Bordetella pertussis is the causative agent of the whooping cough. Have you heard whooping cough? Everybody heard the whooping cough? Okay, then I can skip. If you want to hear it again, the reason why I'm not doing the link is because I'll have to unplug the mic, and plugging it back, it's the whole ordeal. It's really a pain in the butt. It's the link to the video of an adult having a whooping cough. Okay, so if you want, just follow the link. It's quite an interesting disease. So Bordetella pertussis is the infection of the respiratory tract, and the infection has two stages. First stage is so-called catarrhal stage, when the person develops typical signs and symptoms of the mild upper respiratory tract infection, like runny nose, rhinorrhea, sneezing, coughing, low-grade fever. Nothing of a particular interest. And then catarrhal stage is over. It may last about 2 weeks to a month. And the second stage, which is called paroxysmal, starts. The reason why paroxysmal stage starts is that the infection, the Bordetella pertussis, the microbe, using its toxins, pertussis, tracheal, and hemolysin toxins. These toxins destroy the cilia in the respiratory tract. What is the function of cilia in the respiratory tract? To move mucus. So when cilia is destroyed, do we still produce mucus? We do. Can we move it? The only way we can is to cough. And that's what we do. And we just cannot stop. Okay? How bad it is? The bouts of cough can last for 30-40 minutes. Can lead to vomiting. Very typical sign, whooping cough. It's the bloodshot eyes. Coughing is so violent that blood vessels in the eyes burst. And this condition may be for a couple of months. It's really long-term disease. And the worst part is that during the paroxysmal stage, the bacteria is usually not there anymore. So treatment with antibiotics helps just a little. The main therapy is supportive, different types of mucus relievers and anti-inflammatory drugs. And then during convalescent stage, that's when paroxysms start to go down. So it's a long disease. And if you would follow, I'm not saying you must, I'm not going to ask you, did you follow that link on the exam or check something like that. But I deliberately put the adult as an example. Because the recordings of children that cough, they are even more disturbing. And they have the same type of disease. The good thing about pertussis, we can prevent it very successfully. It's a component of diphtheria, tetanus, pertussis vaccine. It is acellular now. As I mentioned before, acellular pertussis vaccine has a lower efficiency than the one that we used decades ago, but it also has lower levels of side effects. And the thing is, pertussis is entirely human infection. If we keep vaccinating, maybe at some point we'll be able to eradicate it completely, which would be lovely. That makes sense? So please know about the effects of these 3 virulence factors on the human ciliated epithelium. Now the transmission, of course, respiratory. Okay. Neisseria. It's a fastidious. What is fastidious? Fastidious bacteria. What does it require? Specific nutrients. So Neisseria is a fastidious bacteria. There are 2 major species of interest: Neisseria meningitidis and Neisseria gonorrhea. Neisseria meningitidis, you can see the growth of Neisseria meningitidis in the blood agar here. It's also called meningococcal infection, and it's the most severe form of bacterial meningitis, community-acquired bacterial meningitis. There's a number of virulence factors, of which I want you to focus on the capsule. Okay, but this bacterium can sometimes be found in the human upper respiratory tract. And the mild form of infection with Neisseria meningitidis will be just the respiratory tract infection, sort of pharyngitis. Sometimes it can cause otitis media, but it is extremely capable of getting into the bloodstream, getting all the way into the brain, and cause inflammation of the meninges. The reason we're concerned so much about this infection is the time from the onset of symptoms to death can be as short as 24 hours. 48 is more typical. Okay, bacterial meningitis, meningococcal meningitis, is extremely dangerous and can be treated in a very proactive way. The characteristic symptom of meningococcal meningitis comes surprisingly on the limbs. The symptom is called petechia. Due to the thrombocytopenia caused by infection, becomes systemic infection, you have multiple little blood spillovers into the surrounding tissues. Does that make sense? So that's a characteristic symptom that allows physicians to tell meningococcal meningitis with petechia from non-meningococcal, the one that can be caused by Streptococcus pneumoniae, Haemophilus influenza. Okay, we do have vaccine. This vaccine is mandatory to attend a public school in the state of Ohio. It is safe and effective. Okay. Interesting thing about Neisseria, there were several cases of lab-acquired Neisseria meningitis when it was isolated from the clinical sample, and it produces really foul smell. It was isolated from the clinical sample, and the lab assistant, okay, lab worker, pulled out the plates from the incubator, opened them up, and sniffed them. That was enough to acquire few bacteria that, when, as you can imagine, nose is the perfect entrance point for the cerebral infections. So they went directly into the brain and caused meningitis, and the person was dead in 24 hours. It pretty much skipped up respiratory tract. So there is a rule in the labs that work with Neisseria. Plates, you do not open the plates outside of the biosafety level. Biosafety level 2 or level 2 hood. Okay, so just don't open them on the table. You have to put them in the hood, be protected, and then you can open and work with it. That makes sense? Neisseria gonorrhea is another member of the same genus. It's the sexually transmitted disease that we call gonorrhea. Okay. Often, as many other sexually transmitted diseases, sorry, asymptomatic. Major symptom that can help to determine that something is wrong is the purulent discharge, penile or vaginal discharge. If gonorrhea is left untreated, it can progress as any other sexually transmitted disease to urethritis, cervicitis, pelvic inflammatory disease, lead to infertility. The good thing about gonorrhea and practically any sexually transmitted disease, it's fairly easy to treat. Antibiotics are largely effective, and it's fairly easy to prevent, okay, by using protection during the sexual intercourse. I'm not asking about any virulence factors here for the Neisseria gonorrhea. Now we're going to talk about commensals. So these are members of Gamma proteobacteria family. And when we say commensal, in terms of the relationships, what does that mean? Commensal microbe. What is it? Commensal. You're absolutely right. So one member of the community benefits and another member doesn't really care. When we apply the term commensal to enterobacteria, we usually mean that bacteria have safe haven and source of nutrients, and person, human, doesn't really care. Does that make sense? So I want to mention this 4 species. You worked with all of them except Klebsiella. Okay, so this is characteristic enterobacteria. We never plated Klebsiella. That's Proteus mirabilis. And that's beautiful red colonies of Serratia marcescens. Some of them have, as the virulence factor, have capsules. I'm not asking about the virulence factors for these guys. I will tell you what you have to focus on. Interesting feature of Proteus mirabilis, which is the common cause of urinary tract infections, is the production of urease. That's the enzyme that breaks down urea and can lead to the formation of kidney stones. All of these microbes can be found in the microbiome, the human gut. I deliberately do not say normally, because some people, for instance, Escherichia marcescens is not very common member of the human microbiome, but it can be found in people who have no symptoms of infection. That makes sense? Enterobacter aerogenes is a normal commensal bacteria, okay? Different strains can be more or less invasive, more or less drug resistant, and remember, resistance to antibiotics per se can be considered a virulence factor. When Enterobacter is in the gut, it's fine. It doesn't cause disease. But when it leaves the gut, it may enter the urinary tract, causing the urinary tract infection. Even more important, it can cause pneumonia or sepsis. Okay. Klebsiella pneumonia is sort of a misguided name. Okay. You can say, oh, Klebsiella pneumonia, it causes pneumonia. Well, that is true, it does. It does cause pneumonia, and for some reason, Klebsiella pneumonia has a particular propensity to cause that lung disease in people with impaired respiratory function, people with COPD or cystic fibrosis. Okay, it also is very common. It causes pneumonia for some reason. Klebsiella loves patients with alcoholism. Maybe because of the impaired immune system, some liver enzymes contribute to it. We don't really know, but it's pretty common in patients with alcoholism. It doesn't cause only pneumonia. Wound infections, urinary tract infections also can be Klebsiella. These guys, Enterobacter, Klebsiella, Proteus mirabilis, Escherichia, in which environment the patients are most likely to acquire it? Hospital, yes, in the hospital. A lot of people are sick, okay, and you cannot possibly maintain the same level of cleanliness in the hospital because of large number of patients. You know, people try, but let's admit, if there is a common bathroom, then there's going to be transmission through that bathroom, as clean as you keep it. Proteus mirabilis is another example of microbe that can be found in the human gut microbiome. All the same, it's very common cause of urinary tract infections. Okay, so understand that Klebsiella and Proteus and Enterobacter, common causes of nosocomial infection. Klebsiella and Proteus, urinary tract infections. Klebsiella pneumonia also causes pneumonia. Escherichia, less invasive, again, affects people in the hospitals. Okay, it's nosocomial infection. We discussed that you can find it sometimes. It's the orange slime. When you leave the toilet for a while without flushing, it can be at the edge of the water. That pinkish orange slime, that can be Escherichia. Now, a few things that I wanted to mention. Yeah, thing number one, all of these microbes can be acquired through the autoinoculation. Does that make sense? From gastrointestinal tract to the urinary tract. So for females, it can be true autoinoculation. Okay, some hygienic problems, that anatomical proximity of anal and urethral orifice, it all contributes to the increased risk of auto inoculation. For males, though, one of the common causes of urinary tract infections is unprotected anal sex, because that exposes quite vulnerable mucosa of urethral mucosa to the microbes that are not supposed to be there by any means. Actually, urethra, male urethra, if you go a little deeper from urethral orifice, is sterile. There are no microbes in urethra normally. So these guys have a field day then. Now, I specifically mention here guided by antibiotic susceptibility. This is another problem. These microbes are present in the human gut, so they are constantly exposed to the antibiotics. Does that make sense? Right? Since they are constantly exposed to antibiotics, they have to learn how to survive those antibiotics. So this normal, often non-invasive bacteria, not GI invasive bacteria, have a huge spectrum of antibiotic resistance. And that is why every hospital performs so-called antibiogram every so often. I mentioned it when we did the antibiotic resistance lab. They sample different locations in the hospital, determine which species are most abundant in those locations, and then using either Kirby-Bauer test or E-strips, they determine the antibiotic susceptibility of these microbes. Because if patient acquires nosocomial infection, then they know what to treat infection with. Going back to nosocomial infections, it would be a great moment to talk about them now. Think about this. You've got a bunch of people, and this bunch of people shed bacteria all around. Does that make sense? They shed their own microbiome. So what patients in a hospital acquire is they acquire somebody else's normal bacteria. Does that make sense? You are getting used to your own microbes. And that was, it may be a little bit of a rambling here, but that was summarized by one of the microbiologists. I heard that statement. He was asked, being a microbiologist, how did it change your life? What would you do different? Since you know a lot about microbes. He said, the one thing I would definitely do different, I would wash my hands before peeing, not after. And that makes perfect sense, because when you get into the restroom, you have all kinds of microbes in your hands, and you're touching very sensitive body parts. Okay? So you want to remove everything foreign from your hands, then you pee, do whatever you want, and then you can leave. Because if you don't care about other people, you don't have to wash your hands, really. It's your microbiome now. It's on your hands. Fine. So that was kind of an interesting statement. Now, this is the bacteria that is probably the most studied microorganism in the history of biology. It's the typical model organism, E. coli, Escherichia coli, that is used in a bunch of research and industrial applications. We know sequences of a bunch of strains. In the wild, E. coli can be found in the intestines. Don't get me wrong, it's not a most abundant member of a human microbiome. But presence of E. coli in the stool sample doesn't necessarily represent the disease. Okay, but there are pathogenic strains of E. coli, and I'm going to briefly mention some of them. What you have to understand, all E. coli strains, all pathogenic strains, cause diarrhea in one form or another, and they all have different types of virulence factors. Now, I will tell you which ones I want you to know and remember. So, enterotoxigenic E. coli has the two endotoxins, okay, heat stable and heat labile endotoxins. So obviously, heat labile can be destroyed by boiling, for instance. Heat stable will be stable and it's responsible for traveler's diarrhea. You know, when you go to some new place, when you're in the trip, sometimes you arrive and you try local food and you develop diarrhea. That is largely due to the local strain of enterotoxigenic E. coli, especially if it's not fully cooked food, if it's like fruits, vegetables, partially cooked. Okay, that's pretty common. It's not usually life-threatening because to a large extent the infection is self-limiting. Okay. Enteropathogenic E. coli has the virulence factor that disrupts the microvilli, and when microvilli on the epithelial cells are disrupted, the absorption of nutrients is disrupted too. Malabsorption leads to diarrhea, very common in infants. Enteroinvasive is the type of the infection in which cells actually penetrate the epithelium. They aren't intracellular actually, okay? But destruction of epithelium may not only lead to diarrhea, but also end up in dysentery, which, as you remember, is the bloody stool. Sort of a culmination here is enterohemorrhagic E. coli, or EHEC, or O157H7, great license plate number. Okay. You may have heard about outbreaks of this disease in the United States and in Europe. The graph in the right bottom corner, and this is the link to the paper that reviews the outbreaks of enterohemorrhagic E. coli in the United States. This picture in the right bottom corner shows you the distribution of sources for enterohemorrhagic E. coli in the United States, and you can see, and I want you to know the epidemiology of this particular strain. What is the major source of infection if you would look throughout the entire picture? Huh? Yeah. Food. Foodborne, the white. So this microbe is acquired from the food. The food itself is not broken down further, but I can tell you the most common source of enterohemorrhagic E. coli is the ground beef. In the recent years, though, the bean sprouts became, for some reason, extremely contaminated with this bug. Just extremely contaminated. Several years ago, there was a big outbreak of enterohemorrhagic E. coli infection in Germany, which took lives of a couple dozen people, as far as I can remember, and a couple thousand developed so-called hemolytic uremic syndrome. Okay, that's the situation when red blood cells become destroyed and heme is spilled over and kills the kidneys. So hemolytic hemolysis, uremic, urea in the blood, okay, elevated levels of urea in the blood, which means kidneys are not working properly. The virulence factors that I want you to know for enterohemorrhagic E. coli are two Shiga toxins. It promotes cell death, and I'm gonna mention how they work when we move to shigellosis. So Shiga toxins. Now, Shiga toxins are genes, and they are acquired by enterohemorrhagic E. coli via the horizontal gene transfer. Does that make sense? So you can remove those genes from the bacteria and it will stop being pathogenic. You can put those Shiga toxin genes back, and we discussed it when we talked about Koch's postulates. You can put those Shiga toxin genes back and it will regain the pathogenicity. This is very severe infection, don't get me wrong, very severe infection. And it rarely kills the people. It's not that deadly, but the problem is that it is often misdiagnosed, and when it progresses to hemolytic uremic syndrome, often the irreparable damage to the kidneys is already done. Enteroaggregative E. coli is the common cause of diarrhea, and it leads to the shortening of microvilli, which also leads to malabsorption. Diffuse aggregative E. coli leads to elongation of microvilli and again diarrhea. Now, before we move on, I want to assure you, you will not be asked about things like which of the following strains of E. coli causes traveler's diarrhea. Strain that I want you to focus on is enterohemorrhagic strain. I want you to know what the hemolytic uremic syndrome is. I want you to know what is the epidemiology. When I say epidemiology, source. Okay? I want you to know the virulence factors, Shiga toxins. Am I clear on that? Now, E. coli is not only a big cause of the gastrointestinal distress, it is the leading cause of urinary tract infections. Absolutely. If you would look at the list of microbes, first is going to be E. coli, and then it's going to be followed by the microbes like Klebsiella pneumonia, Trobacteria genus, Proteus mirabilis, Staphylococcus saprophyticus, and so on and so forth. E. coli contributes to about 70% of all urinary tract infections, mostly due to the autoinoculation. Moreover, many cases. So, how does the urinary tract infection manifest itself? Frequent urination, and often you just cannot hold it. So there's like, I need to go now or just now. What else? May or may not be. Dysuria, may or may not be. It depends. Often flanking pain in the back if it reaches farther, if it reaches the kidneys. Often blood in the urine. Not necessarily, it doesn't mean that you like pee blood, but the microscopic sample of the urine will show white blood cells. Okay? Does that make sense? I had something very smart to say about it and completely just bombed it. If it'll come back about urinary tract. Oh, so symptoms, as you can see, for urinary tract infection are not extremely, how to say, not very characteristic. You know, they sort of may or may not be dysuria, may or may not be flanking pain. You're definitely not going to be able to see white blood cells by yourself. Usually fever. Usually you're going to feel crappy, like really crappy. But other than that, not much. It's often a diagnosis by default in children. If the child is brought to the hospital with high fever and nothing else, that is likely urinary tract infection. Does that make sense? well, high fever and leukocytosis, because you're going to have elevation of white blood cells, absolutely, because of the bacterial infection. Viral infections usually do not elevate white blood cells that much. Okay, then often it is told, okay, it's probably urinary tract infection. Let's treat it like one. And because kids can't really describe flanking pain or dysuria. Either they don't know what it is, or, especially if they're aged like 2.5, they don't know such words. Okay. Now, another thing that I want to mention about E. coli, neonatal meningitis. It's a third common cause of neonatal meningitis, along with Streptococci group B, Strep galactiae, Listeria monocytogenes. E. coli is the third most common cause of neonatal meningitis. These, Shigella and Salmonella, love these guys. Not so much Shigella, but Salmonella is just gorgeous. Shigella possesses a bunch of virulence factors, starting from adhesins to type 3 secretion system. Type 3 secretion system is the way to inject bacterial proteins into the host cell. But one factor that I want you to focus on is shigotoxin. Okay? So shigotoxin, I told you I'm going to mention the mechanism. Without details about the intracellular transport, shigotoxin inhibits protein synthesis. Which, as you can imagine, leads to the cell death. During the initial onset of the disease, shigellosis manifests as the watery diarrhea, which eventually develops into the dysentery with the pus, white blood cells, and blood in the stool. You can see the white and red blood cells in a stool sample, the patient with shigellosis. Shigellosis is severe disease. It can be deadly. Okay, there are examples of asymptomatic colonization with shigellosis. Different species can be found in different parts of the world. Shigella sonnae is common to developed countries like United States. Shigella flexneri to the developing ones. There are several thousand cases of shigellosis in the United States every year. And obviously the transmission of shigellosis is fecal-oral. It's the fecal contamination of foods, fecal contamination of water, or fecal contamination of fomites. Okay? Now, establishing sort of a link between what we talk about now and E. coli that we just finished talking. E. coli acquires the same shigotoxin from Shigella via horizontal gene transfer. Does that make sense? So you can see that species to species transfer of genes can occur between bacteria. Does that make sense? However, and this graph shows you, it's a CDC data from CDC website, the incidence of shigellosis per 100,000 population in the United States. And you can say, okay, it's 10 per 100,000, which means 100 per million, which will put the numbers in about 30,000 cases in the United States alone per year. It's quite a lot. Okay. Salmonella is a nightmare in terms of the taxonomy. The Salmonella that we worked with had a name on the tube, Salmonella typhimurium. Turns out that now taxonomists, based on the genetic sequence, I show two species, Salmonella enterica and Salmonella bangori. Inside of those species, there are different serogroups, something like strains. types of microbes that are slightly different. Historically, those serogroups were often referred to as species. So in one book, you may see only 2 species, Salmonella enterica, Salmonella bongori. In other book, you can see Salmonella typhi, Salmonella typhimurium, Salmonella enterica. It's all very confusing. This is the reason why there are going to be no questions about Salmonella taxonomy, I promise. But I may ask you about some other features of that wonderful disease. So first of all, it possesses a number of virulence factors, of which I want to highlight 2. It's a capsule. When I say I want to highlight, pay attention to them, I may ask. And typhoid toxin. Salmonellosis can manifest in many ways, but there are 2 major types of salmonellosis. The mild salmonellosis is enteritis. Did anyone ever have salmonellosis in your life? I was 9. I learned what violent vomiting means. I had dentures, the children's dentures, corrective dentures. I lost them and didn't even notice. They were washed away. The vomiting was, I thought I'm going to puke my guts out, brain out, whatever's inside, it's all going to go out. It was awful. And you have about 102, 103 fever. It's a complete disaster. You know, I got antibiotics, I got better like next day. Really, it's unforgettable experience. That is considered to be mild. And then there is fever, typhoid and paratyphoid fever. In this case, patient develops bacteremia. Bacteria spread to multiple organs, which causes massive generalized response to typhoid toxin and endotoxin. Okay? Very high fever, or may lead to organ dysfunction and eventually death. Have you heard about the history of typhoid Mary, asymptomatic colonization with salmonella? It's good. It's actually, I like to see when, you know, like I ask what cholera is and people tell me cholera, what it is. It's good because the public health system works. We don't know what the disease is. Typhoid Mary was the Irish cook. Very good Irish cook. This woman lived in New York in the beginning of 20th century, and she worked sort of like a freelance cook or short-term contract cook for multiple wealthy families in New York. And enigmatically, people in those families went down with not only enteric disease, but some fever, really severe fever, and quite a few of them died. Eventually, this trace of bodies that Typhoid Mary left behind her was noticed by the public health authorities in New York. They started to dig into this story, and they figured the association between Typhoid Mary and deaths, and they banned her from cooking. Kind of reasonable thing to do. It was her only source of income. So after a while, and it's slightly different now. Now we have like electronic records and whatnot. Everybody can look it up, and if you were stigmatized, it's forever. Then, okay, I'm gonna throw all the paperwork and start cooking again, and that's what she did. She came back and started to work for people in New York. Guess what? People started to die again. This time the response was quicker. Authorities sort of traced her. I don't want to say captured her, but forcefully moved her to, it's not Ellis Island, one of the islands in the harbor of New York. It's next to Ellis Island. I think it's Plum Island. It's a Plum Island. They had an isolation facility there. And she left New York and lived on Plum Island until she died. She technically wasn't imprisoned, so I mean, she wasn't in the cell or something, but she was absolutely banned from leaving this quarantine facility till the rest of her life. Okay, so that's the story. So she was an asymptomatic carrier of Salmonella typhimurium, and that happens. There are people that carry Salmonella. Okay. Vibrios, and it's going to be the last one, then we're going to take a break. Vibrio, lovely microbe. Vibrio cholerae, Vibrio vulnificus. We're going to start with a boring one. Vibrio vulnificus. Number of virulence factors, including collagenase, protease, cytolysins. Don't have to focus on them. It causes wound infections. Vibrio vulnificus is associated with shellfish. So it lives in water and lives on the shellfish. So you can acquire this disease by swimming in the contaminated water. I don't think there were cases of Vibrio vulnificus off the shores of the United States, whether it's Atlantic Ocean or Gulf of Mexico. I don't talk about Pacific Ocean, it's freaking cold. So it's probably Mediterranean, Indian Ocean. It's pretty common in Indian Ocean, the coast of India itself, eastern coast of Africa, and so on and so forth. When you swim, bacteria can get into the wound, because the wound infection, it can develop very quickly, causing septicemia. Mortality rate can reach up to 50%. It's not frequent, but it's pretty common. Okay? Vibrio cholerae. Microbe that can be normally found in the contaminated water. Is very high infectious dose, by the way. And these microbes can grow in practically everything. The only thing they need is the salt. And just a little bit of salt, not a lot. Vibrio cholerae causes gastroenteritis. There's quite an interesting toxin, of which I want you, that's the one I want you to focus on. So cholera toxin stimulates the enzyme called adenylate cyclase. Adenylate cyclase produces intracellular signaling molecule, cyclic AMP. Cyclic AMP then stimulates signals to the various channels and pumps in the cellular membrane, and epithelium in the gut starts to secrete sodium, potassium, water into the lumen of intestine. When it all gets secreted, we've got the diarrhea. Does that make sense? How bad the diarrhea is? It's awful. Every 15 to 20 minutes. People die not from the infection, they die from dehydration. Cholera is very easily treated by installing the IV line. That's the only way to compensate for the fluid loss, and pretty much wait. So it's rather supportive. You can use antibiotics, but antibiotics are useless without the proper fluid replacement, electrolyte replacement. Does that make sense? Vibrio cholerae can be removed from the water, the water treatment plants. It's a great example of how failing infrastructure led to the outbreak of cholera. Great example of that is Haiti. I don't remember how many years ago there was an earthquake in Haiti, pretty devastating, that killed something like 150,000 people. It's pretty bad. And like that was not enough, further problems started because of the earthquake destroyed the infrastructure, including the water treatment plants. Now, cholera was not really endemic to Haiti. And for some reason, few weeks after the earthquake, the huge outbreak started. And the investigation into that outbreak revealed pretty interesting details. You can use genetic analysis to trace down the microbes. You can see, okay, this microbe came from that place. Does that make sense? So this microbe that caused the outbreak of cholera in Haiti was traced down to Nepal, the little country north of India in the Himalayan mountains. So that was quite enigmatic, you know, where Haiti's like here. You can see the cholera outbreaks in the Caribbean, and Nepal is here. It's quite a long travel. Turned out that there was a team of Nepalese soldiers that came as aid workers to Haiti. And when they were tested, turned out that they were asymptomatic carriers of cholera. They had no disease, they had cholera in the guts. So they came over, imagine, infrastructure is gone, you don't have proper toilets, you don't have proper disposal of feces, so this cholera microbes got into the water, which water then was used as a drinking water, or maybe it got contaminated, it contaminated foods and whatnot, so it eventually started, and once the cholera outbreak starts, it's very hard to quench it, because it's in the water, it's just going to circulate. Does that make sense? And you can see epidemiology-wise, cholera outbreaks are associated with developing countries, poor countries, countries that do not have proper water treatment in every place. So cholera outbreak in the United States is not possible, just not possible, because of the water treatment plants, because of the way we treat the water here. So now imagine you have India, where cholera is quite abundant. Ever heard about Gang River? It's a river in India. It's a sanctioned river. So what you can use river for? Your wildest imagination. Washing clothes. What else? Transportation. Yeah, there are boats and all other stuff. Huh? Bathing. Yes. Source of water for you. For something else? Cattle. Fishing. Makes a great cemetery. Just dump dead people in it. Now imagine all of it happens in India, where there's more than 1 billion people. So people use the same river for drinking from it. Cattle goes and drinks from it, and believe me, cattle doesn't really care about pooping far from water. Washing clothes, fishing, transportation. It also used as a sewer, of course. They bury people there, so it's quite a soup. Okay. So cholera, it's practically endemic in India. And the main problem is how you can, if not clean the water completely in village settings, but how can you reduce the contamination? Turns out, if you take a sari cloth, which is cotton, and it's some natural fabric, the cotton or linen, I know. Anyway, you fold ceramic cloth 4 times, and you filter water through ceramic cloth. You significantly reduce the, I want to be very careful with selecting words, you significantly reduce the risk of acquiring cholera from the filtered water. How? It's a cloth. The bacteria are really, really small. You see, these guys are like tiny, 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 maybe like 300 nanometers. Look at the cloth. You can see the holes. So bacteria should just fly through. You're on the right track. It filters out something. Okay, can I walk through that door? Right there. If I open it, can I walk through that? If I'm riding a hippo, can we walk through that door? No. What does the cloth catch? Exactly. It turns out was found that Vibrio cholerae, and I kind of mention it on pus. Shellfish. Of course, you know, you don't filter like, I don't know, crayfish, or you don't filter crabs. You can, you know, take them out with your hands. But there are a lot of tiny, small, minute arthropods. We call them copepods. It's like little crawfish, but it's really tiny. Remember we did the microscopy lab, and you put the water, and there were moving things? Most of them were copepods. Bacteria sticks to those copepods, and turns out 4-folded ceramic cloth can catch those guys. And if you remove them, you remove Vibrio cholerae. And it's recommended, and it reduced the infection tremendously. That make sense? Okay. Let's take a break.